We're celebrating our 25th anniversary here in the Marina. We're Marina Plastic Surgery. We started 25 years ago, and we're happy to be here celebrating those 25 wonderful years. Sure. Back in 1986 we started with just 1 or 2 employees, and Charlie was one of my first employees, and she's been with me for almost 25 years. And Maria was one of my first nurses. She's been with me for 24 years. And Patty, 17 or 18 years, hard to keep track. And we've had many loyal employees been with us right along the way. We started 25 years ago with an office about the size of our reception area now. And we've been blessed, we've been fortunate. We've had 6 expansions, and we're starting our 7th here tomorrow morning. The Institute, the Skincare Institute, which is called the Stevens Institute, which is a non-surgery rejuvenation center where we do facial rejuvenation and body sculpting, all with lasers and light-based technologies, all non-surgically. And we're expanding the Stevens Institute starting tomorrow. We specialize here in making friends for life. I'm writing a book called Patients for Life. We're trying to deliver comprehensive cosmetic care, not just surgeries, but also cosmetic medicine, non-surgical rejuvenation. And we have our patients, they become our friends and our extended family, and they come to us on a monthly basis or a quarterly basis. They may have 2 or 3 surgeries over the course of 25 years. We've seen many patients tonight who have been with us for over 20 years, who have had 2 or 3 surgeries. But more importantly, they come to see us on a frequent basis for their facials, for their skin care, for various non-surgical things, laser hair removal, Botox, fillers, permanent makeup, ZLT cool sculpting, various non-surgical body contouring, cellulite reduction with smooth shapes, and on and on and on. And these friends for life, or patients for life as I like to call them, come to see us frequently, and they came tonight in droves. We had over 600 patients. They closed the Marina Freeway here, they tell me. A reporter told me that he was stuck on the Marina Freeway and couldn't get here because the Marina Freeway was shut down. I said, well, let's see. Not since Obama has that freeway been shut down, so that's pretty good company. Yeah, you know, most people think that cosmetic surgery or plastic surgery is for women, but in fact, up to 20% of my patients are men. We have guys that come in to have their eyelids done, they have their faces lifted, they have liposuction around their tummies or their chest or the love handles, and they come in for a lot of non-surgical services. They come in for ZLT cool sculpting to body sculpt without surgery. They come in for facials, laser hair removal. About 10 years ago it was 10%, and each year I see more men. I think men are becoming more aware that they wear their resume on their face. They're becoming more aware that it's a competitive environment out there. This great recession has put a lot of pressure on people, and men realize that if you look it, you can book it, and they need to look their very best. So they're doing things like laser hair removal and laser blemish removal and cool sculpting and various body sculpting modalities, non-surgically. And then some of them are coming in to have their eyelids done, their bags removed, their faces lifted and tightened. These are professional men. They're every career you can imagine. These aren't just actors. We certainly have plenty of actors, but we have lawyers and judges and doctors and teachers and business people and people from every walk of life you can imagine. Well, if we look over the last 5 to 10 years and see the increase in non-surgical body sculpting and facial rejuvenation, I can only imagine what the next 5 to 10 years hold. I'm sure this exponential rise in consumption and the desire for non-surgicals, along with the technologies we've been seeing, is going to result in a huge increase in non-surgical cosmetic procedures. We're going to be finally seeing non-surgical facelifts, non-surgical tummy tucks, non-surgical breast lifting. If the past predicts the future, I'm certain we'll be having non-surgical procedures. The economics of non-surgical cosmetic medicine are compelling. When we do non-surgical facial rejuvenation or body sculpting. It eliminates the cost of the operating room. It eliminates the cost of the anesthesiologist. And most importantly, eliminates most of the cost with recovery. Most of these procedures are done and the patients go to work in a day or two. This reduction in the cost, the overhead, is enormous. When persons aren't taking a week or two off of work to recover, they save all of that time. The economics are compelling, but it's more than the economics. There's also the risk. Surgery is relatively safe. Thankfully, we've never lost a patient, but surgery is surgery. There's no such thing as minor surgery. There's minor surgeons. And whenever we can do a non-surgical improvement and avoid the surgery, I like to do that. Now, there are people that are not candidates for non-surgery. When you let it get too far, you're going to need the surgery. And then, thankfully, the surgery is very safe. Recoveries are very quick compared to years past. Most of our surgeries are outpatient. The patients go home and sleep in their own bed. The ones which are not, they don't stay in the hospital. They go to the aftercare facility where they spend 1 to 3 days at Serenity here in Santa Monica, right across from St. John's Hospital. And there they receive one-on-one nursing, and it's a beautiful facility. And the patients come and see me each day. They're brought in from Serenity. We examine them, and then they ultimately either go home or they go to a local hotel room. About a third of my patients actually fly in for surgery. Another third drive in over 2 hours, and then the final third stay are about in the 2-hour area. So these out-of-town patients who fly in to see me frequently will stay in Serenity. There's no question that these non-surgical improvements are more economical, and they're increasing the amount of people that are having the procedures because they're much more affordable and there's less time away from work and less risk. Many people are saying, hey, that's for me. They want to look as good as they feel, and now they don't have to go to sleep, and now they don't have to have an incision, and now they don't have to have scarring, and they don't have to have healing or the risk of bleeding or an infection and so forth. So the two things are coming together in that there's an increasing demand to look as good as you feel and to look as good as you possibly can. And there's also an increased number of procedures where one can do it non-surgically. So you've got the increased demand, you've got the increased availability of safe non-surgical procedures which are economically much more attractive, and altogether that has resulted in a rapid and exponential increase in the number of procedures. Elective cosmetic surgery and elective cosmetic medical non-surgical procedures are under very close scrutiny. And when you don't get it right, you're going to hear about it. And the tolerance of error or tolerance of inadequate results is very low. The good news is most of the procedures and most of the surgery are excellent. You rarely see a result nowadays that isn't excellent. Patients are extremely happy with their results. The reason so many people were here tonight is they're extremely happy with their results over a 25-year period. We have over 40,000 patients. We have patients that have been with me for over 20 years. Many that have been with me for 22, 23, 24, and even we saw today 2 patients that have been with me for 25 years. I saw my first patient tonight. I saw numerous patients from 25 years ago. People who have had 3 and in some cases 4 procedures over this period of time. People I met in their 20s and 30s that are now in their 40s, 50s, and 60s. So patients are very happy. They're very satisfied. They send their friends. They send their family. And lately, patients have been sending me their children. I have patients that I've grown up with, and they now have children, and they're sending me their children, which is a blessing and a compliment and a humbling, wonderful thing. I receive such personal satisfaction from helping people feel and look better. I know when they look better that they feel more confident. They oftentimes bestow compliments on me that I don't deserve. I didn't get them the job or the husband or the promotion. They got it, but they felt better about themselves. And when I can help a person feel better about themselves and change their attitude and increase their confidence, when they walk in to see me with a spring in their step, if it's a youngster, a male who has male breasts and I remove him and he walks in a tight polo shirt, or a woman with large pendulous breasts, either a teenager or a person my age who comes in and she's now wearing a nice attractive top and she's confident, her shoulders are up and back and she says my back and neck doesn't hurt, or someone that comes in and they can see better because their eyelids aren't obstructing their vision, and on and on and on. I receive such satisfaction I can't tell you. I'm as enthusiastic now as I was 25 years ago, probably even more so. I know more about it. I know how to do it better. I have these wonderful patients who hug me and they kiss me and they show their appreciation. We're huggers here, and we hug our patients. We love our patients, and they are my patients for life.